The bird flu outbreak is escalating and taking a toll on poultry farms across the country. Most recently, Minnesota has been hit, forcing the state's governor to call for a state of emergency. With more on this is the founder of Gaynor Integrative Oncology, that's a test, and author of the gene therapy plan, Dr. Mitch Gaynor. Great to have you back on the show. Always good to see you, Dr. Mitch. So let's talk about this bird flu. So Minnesota now a state of emergency. There are some 16 states that have incidences of this. I believe only 2 now have declared a state of emergency. What are the issues for humans at this point?
Well, right now, there's not a huge issue for humans, but it is worrisome in the sense that this is brought in by waterfowl from Asia. It was actually first seen in Canada and British Columbia, and their droppings have infected flocks in numerous states, but it's not highly transmissible to humans.
So what's the worry for us then, ultimately? Is it livestock being infected and they have to be killed, or what?
That's the major issue, because it's very, very deadly to chickens, to turkeys. About 3.8 million have had to be slaughtered so far. They die relatively rapidly. But the H5N2 is very different than the previous one from China, the H5N1, which was more contagious. But even workers in this country have not contracted the bird flu from this.
So what do we need to be doing, or if anything, because of this massive rate of infection?
The major thing is hope for warmer weather, spring weather. That should slow, actually, the spread of the virus. And also, I think the farmers are being very conscientious, but you don't have to worry. You cannot get bird flu from eggs. You cannot get it from cooked chicken. So I think the risk to humans is relatively low. They're offering Tamiflu for workers, but nobody's contracted it yet.
Huh. All right, well, you know, we've got the bird flu going on. There's also listeria out there. We talked about Bluebell last week. Now, Jenny's Splendid Ice Cream, they have problems too. Tell me about that, and how big a threat is listeria? Now, that is a problem for humans.
The listeria is much more of a threat. Listeria is a bacteria, and it's mainly a threat to pregnant women, very young children, and immunocompromised adults, such as those with HIV or on chemotherapy. But the listeria has already been associated with 3 confirmed deaths. 10 people have been sickened by it. And it's not usually found in ice cream, because freezing, it's usually not able to grow. So this is a bit more worrisome.
A bit more worrisome and concerning. Tell me more about the symptoms I may face if I had ingested some of this listeria bacteria, and what I should do if I exhibit those symptoms.
The major people that need to worry about it, again, are pregnant women. Most of the really serious side effects happen to either during pregnancy, because it can be transmitted to the fetus, and the fetus can be born with severe listeriosis, which is often fatal. Also, elderly people can get diarrhea, flu-like illness, fever. Occasionally you need an antibiotic for it. Most times, for somebody like yourself, you just have very mild symptoms, may not even notice them.
But if you've got a young child or an older person or a pregnant woman in your household, you have to be super careful, right, Doc?
Absolutely.
All right, thanks for coming on. And we will pray for that warmer weather for many reasons. Thank you so much.
Thank you.